Once a brain tumor is suspected, how do we confirm that the person has a brain tumor? The most common way of doing this is to do a scan of the brain, a scan of the head. A scan that we commonly do is what we call a MRI scan, the magnetic resonance imaging of the head. Now, this is a scan that uses magnetism and magnetic fields to generate signals from the body tissues, and this is detected, and a computer processes these into an image, into a three-dimensional image of the head, in which one can see the structures that lie in the patient's body. And there we can detect the normal as well as the abnormal structures. Current generation MRI scans are extremely sensitive and can pick up even very fine abnormalities. We often use an intravenous dye to enhance or to make the MRI scan more specific and to help us with the detection of some kinds of smaller tumors. There are other specialized kinds of MRI sequences that can help us understand the chemistry of these tumors, the chemical makeup of these tumors. It can help us understand how these tumors have spread and which are the structures that are affected within the brain. And apart from the diagnosis, these are also very important to help us with planning the treatment. There are other kinds of scans like the CT scan and the PET scan, what is called the PET scan, the positron emission tomography, that uses a radioactive tracer to try to identify certain abnormalities within the brain, which can also help us in certain situations to diagnose these tumors.